Surprises, I hope. My name is Daniel Baden, and the great temptation for everybody who presents a talk involving Viagra is, and it's probably a little bit pathetic, is to have a quick little story about it, and here's mine. An old man, 96 years old, walks into a clinic and says, "Doctor, could you please prescribe me 1/10 of a Viagra tablet?" And the doctor says, "Well, I admire that you're still active, but what do you expect 1/10 of a tablet to do?" And the little old man turns around and says, "Well, at my age, I'd just like to stop weeing on my slippers." So, okay, erectile dysfunction. We do have a lot to thank with Viagra, because who 15 years ago would have thought the incidence of erectile dysfunction is anywhere near what we are seeing these days? It was a condition that everybody hid, nobody talked about, and I remember 20 years ago, sometimes patients would come up and talk, and the wife would come up and say, "Oh, can you help my husband do something?" The men would never ever come. So I'm very thankful to the Viagras and the Cialises of the world, because I actually think they've allowed men and their partners to talk about the condition. The prevalence is 52% to some degree, with 10% complete erectile dysfunction in males over 40 years. Expected to double over the next 25 years. I guess that's a number of reasons. Some of the lifestyle factors we'll be talking about, but certainly some of the confidence in coming to you guys, basically, to talk about. Only 30% currently seek help, though. So there's a vast sea of men out there who aren't able to perform properly, and certainly 70% of them don't want to talk to you about it. No, some degree. So they may have failure once in that time. They may have failure twice. So it's pretty general data. It comes out of Lancet and another study there. But that this is some degree of dysfunction, okay, which they may be perfectly normal, have a particularly stressful period because of an examination or something, and not be able to perform that time. History of erectile dysfunction. Hippocrates believed that erections occurred when air and spirits entered the penis. Of course, too much spirits doesn't help. Risk factors. Okay, increased lifespan. It's not an absolute. Just because you're getting older doesn't mean you have to lose the ability to have an erection. Lifestyle factors are very important. We've talked about apnea a little bit today. I heard the previous speaker, and I think apnea is an incredibly relevant topic, because if you can control sleep apnea, you can get a 60% increase in endogenous nitric oxide production, simply by teaching people how to breathe through their nose properly, and stimulates endothelial cells, and that's where your nitric oxide is produced, of course. Mouth breathers have a much lower rate. So by doing very little, but by getting people to sleep properly, you'll increase endogenous nitric oxide. Endocrine changes, stress, of course. And this whole picture, I know you've probably talked about it all weekend. However, these are key issues that a naturopath would deal with every day. Stress, physiological changes, other diseases, all leading to what we call Syndrome X, and the topic of inflammation comes up over and over and over. Interesting, just as a little note, there's one little tiny study that just put motorbike riding in there as a risk factor for erectile dysfunction, and I thought I'd put it in there just for sake of completeness. It's very important, though, from a naturopathic point of view, to consider the difference in achieving versus maintaining an erection. There's difficulty in if you have difficulty maintaining an erection, it's likely to be a psychological issue. If you have difficulty in achieving, it's likely to have some other organic cause. Hormones. Now, this I'll probably be a little bit controversial with some of your speakers over the weekend. But it's important you hear what happens from the hippie witch doctor side of things. The testosterone decreases with age, we know that, but it doesn't necessarily mean that the patient will suffer erectile dysfunction. There are a number of studies out there that show even men with half the testosterone levels that they had, when they were 25, when they're 50, it doesn't affect their erections. And testosterone supplements increase the desire but not necessarily the erection quality. So, you know, the mind is willing but the flesh is weak, I guess. We also think it's very important to consider some other hormones. Dopamine is one of them. Serotonin, or dopamine because it increases the sensation of pleasure, and serotonin, because serotonin is basically the hormone in your body that says all systems normal, go ahead. And DHEA, increasing DHEA has definitely got an overall positive for erectile dysfunction, so that we would consider that also very important. I'm sorry for the compounding chemist in here, and I don't mean to offend you. However, you know, there is some information coming through and about bio-ID hormone replacement. Some of the opponents to it would suggest that it's not science-based. How can you possibly look at individuals' needs? And some of the long-term effects are unclear. I'm not saying don't use it. I'm saying use it with caution. Now, what we do in the clinics that I'm associated with, we look very long and hard at free radicals and antioxidants, and we have some gadgets to measure people's free radical levels, and these are TGA-approved gadgets. The one thing that we consistently see with female hormones, I must say, or bioidentical female hormones, the trochets and whatever, is a big increase in free radical activity. And there are some commentators suggesting that there's a possibility of this is early days, of course, but you know, here we are at the cutting edge. There are some commentators suggesting that increased use of bio-ID hormones in females may increase certain types of cancer. I think it's very early because uterine cancer particularly, by the way. I think it's very early days because there's no long-term studies. These are just clinical notices. However, the one thing you can determine is there's generally a big increase in free radical activity, which, you know, is often seen in other long-term conditions. So just because something is deemed to be natural doesn't always mean we should be giving it as a supplement. And how natural is natural anyway. So if you're going to give bio-ID hormones, my suggestion would be to use some good antioxidants at the same time. Dopamine increases human growth hormone and testosterone. Tyrosine is a substrate, so sometimes to increase dopamine we'll give patients tyrosine, the amino acid tyrosine supplementation. Other stimulants are coenzyme Q10. Coenzyme Q10 is quite an interesting substance. What it specifically does is that it stimulates the endoplasmic reticulum and produces energy throughout the body. Many years ago, it was thought that it only affected heart muscle, and it would only increase energy production from heart muscle. So it was strongly indicated in congestive heart failure, in angina pectoris, those sorts of conditions. But we've seen in recent times that Q10 has a fairly widespread sort of action. And the doses are also increasing over time. When I started practicing, most Q10 supplements were 10 milligrams, the maximum was 30 milligrams, and that was heroic stuff. These days, you know, it's hard to buy a capsule under 100 milligrams. And in a presentation I recently went to, one of the speakers was talking about using doses of 500 milligrams, which makes it truly a rich man's supplement if you can take 500 milligrams, because it ain't cheap. Ginkgo biloba, there are clinical studies we'll talk about shortly, ginsengs, and one of the latest stars is a herb called rhodiola, which I'll come to shortly. But vitamin B6 and vitamin C, in moderate doses, will also increase dopamine. And for your interest, amphetamines deplete dopamine. So, you know, the kids that come in who have been used ice or some other form of amphetamine, whilst they get an initial excitement for it, if they keep using it, it depletes dopamine, and they lose that excitement that the dopamine will give, or that sensational pleasure.